Let's take a look at a few headlines from the past few days. First, while we are glued to election returns, COVID-19 is sweeping through the country. Yesterday, we hit a new high, recording at least 121,000 new COVID infections in one day. The day before had been 100,000. The Centers for Disease Control is currently forecasting that at least 250,000 Americans will die as a result of COVID by Thanksgiving. So I just want to be clear and cut through the disinformation. COVID-19 is real. It is highly contagious and it is deadly. Here in the United States, the crisis is not getting better. It is getting worse. As of today, there is no cure. As of today, there is no vaccine. And even when the final presidential election results become clear, COVID-19 will still be real, it will still be here, and it will still be deadly. Number two, one of the reasons we are still waiting for the swing states to count votes in this election is because of COVID-19. Now, yes, you heard me say last night, it's absolutely right. Every single election year, states take days or weeks to count all the ballots. But this year, the counting is taking a lot longer because so many more of the ballots were cast by mail. Now, that's actually a good thing because the surge in mail ballots is a direct result of COVID-19. You see, Black folk have shown amazing courage and willingness to risk our own health in order to ensure the health of our democracy. At the same time, we have mostly tried to be as responsible as possible while exercising our right to vote. So this year, more than 100 million people set the record for early voting in our country. And yes, a substantial portion of those early votes were mail ballots because voting by mail was the best way to protect our health and the public's health. Number three, somehow this pandemic is now a partisan issue, but it shouldn't be. In new research published this week in the scientific journal Nature and Human Behavior, these researchers studied the geo-tracking data of 15 million smartphones a day. And what the researchers found is that partisanship, not race, not COVID-19 infection rates, not income, partisanship was the most powerful factor in determining if a community practiced social distancing during that first spike of the pandemic this spring. Democratic areas practiced social distancing much more regularly than Republican areas. This pandemic should not be partisan. Even if the virus requires us to stay away from each other physically, the crisis should have brought us together in a shared determination to save our collective lives. Number four, COVID-19 is not racist, but racism is the reason that Black people are dying at a much higher rate than any other group. Again, according to data, this time from the Color of Coronavirus Project, the Black mortality rate from COVID-19 is more than 3 times higher than for white people. And now another way to think about this is if Black people were dying at the exact same rate as white Americans, there would be nearly 22,000 African Americans alive today. Again, allow me to be clear. COVID-19 is not a racist virus seeking out Black people at a higher rate. In fact, when compared to some other racial groups, Black folks actually have a lower, somewhat lower, likelihood of contracting the virus, but we are more likely to die of it. And that heightened mortality is a result of structural racism that worsens Black health and shortens Black lives even when we're not living in a pandemic. It's a result of public policy that leaves many Black Americans without health insurance. It's a result of environmental racism that puts polluting businesses and bus depots in Black communities, driving up asthma and other respiratory conditions. It's a result of nutritional racism that leaves black neighborhoods without grocery stores or fresh vegetables. It is a result of racism in schools and workplaces that push black people into higher risk, lower reward jobs. It's a result of racism in the criminal punishment system that warehouses black people and holds them in jails, even as COVID-19 rips through the incarcerated population. It is because of well-documented racism in healthcare and in hospitals that underestimate black pain, that assumes black patients are dishonest, and that treats black lives as more disposable. Again, COVID-19 is not racist, but racism makes COVID more deadly for black people.